based in Raleigh. We have been around maybe since, I would say since around 95 that we became a nonprofit. We came together because we wanted to organize a festival, and it's pretty amazing that since then we have grown into an organization that has a very strong vision of a just and equal community where all people who are here are respected, valued, and engaged. So I'm actually a graduate from this program, graduated about 20 years ago. I can't believe it's been that long either. And we've been pretty fortunate to have a capstone team every year. Have had an amazing experience. I think it's been the best experience we've had working with the university and with students. So we have had different ways that we interact with capstone teams. We've had 3 teams that have worked with our reproductive health programs, and then we've had 1 team that has worked with our Líderes de Salud program. And so today I'm hoping to get another team to work with that program. So Pueblo has been around for a long time, and it's been perhaps since around 2000 that we've been doing a lot of work specifically in health issues. So I went to Pueblo in 2004 specifically for the Líderes de Salud program, and it is a lay health advisor program. And initially it was focused on very specific health issues, but I'll talk a little more about that in a bit. We also have a Líderes de Salud Reproductiva program that focuses on reproductive health and lay health advisors. We have 2 programs that focus on breast cancer issues. We have 2 programs that focus on reproductive health issues, one with adults and one with youth. And then we have a program that's called Ventanilla de Salud, which is in collaboration with the Mexican consulate that's in Raleigh. And we have a staff member there who provides information about health and also connects people to resources, because I think that's one of the biggest issues that our community faces. The exciting thing about that program too is we have received recently funding from the American Cancer Society to have 3 of our promotoras there 3 days a week, and we provide stipends for them so they can provide information about cancer as well. So the program that I'm interested in having a capstone team work with us on is the Líderes de Salud program. So as I said, it started in 2004. We had funding from John Rex Endowment initially for 3 years, and then we were able to secure funding for an additional 3 years. And the idea was that we would train promotores or lay health advisors, that we would build partnerships with 3 community-based organizations in Raleigh, and also help them build the capacity to work with the Latino community. And the initial focus was asthma, diabetes, immunizations, dental care, obesity, and then like an overall session on access to healthcare. What's Medicaid, who qualifies for what, when do you go to the emergency room, because that's one of the biggest issues that our community faces, trying to figure out where to go for care. We were pretty fortunate that our funder was wonderful, and we conducted an evaluation after the first 3 years, and the promotores talked about the need for us to address reproductive health and mental health. As an agency, we decided that we would not be doing a separate curriculum on mental health because there was another organization doing that, ALMA, which is a collaboration between UNC and Duke. And we decided that we would be working on reproductive health issues. But the other issue that came up really strongly was the need for us as an agency to talk more about the social determinants of health. And so I was thinking, when I was asked what health issue we would be addressing, we really don't want to address a specific health issue. We want to address the social determinants of health that are really affecting our community's access to health. So we have a curriculum that was developed in 2004. It was modified in 2005 because the original curriculum did not really train the promotores to develop their skills to talk to families. It basically just talked about health issues, but it really didn't help in the leadership development component. The capstone team that we had 2 years ago helped work with the promotores and help develop a curriculum that was more looking at the social determinants of health and looking at how immigration affects health in our communities. And so we have an adapted curriculum, but honestly we haven't had funding to be able to implement the program. We haven't had designated funding for the program since 2010. And so I'm really excited that the executive director that we have now is very passionate about the work with promotores, and we have a very small group of promotores that are still active, because we have continued meeting with them even though we didn't have funding, but we felt like we couldn't just drop them. And so this small group of promotores will be training a new group of promotores beginning in April. And they are using the curriculum that was developed by the capstone team. And so at the same time that this is happening, we as an agency want to undergo a strategic planning process with our promotores. And so we have 5 deliverables. One is for the team to help us evaluate the impact of the program. So the impact the program is having on the community, and whether the promotores have enough information, feel confident that they can share this information, and also they have the capacity to initiate social action. The second issue would be figuring out the impact that the promotores are having on the community. So not the impact on the promotores, but the impact that the promotores are having within the families they work with. We also are shifting the program structure, and the strategic plan will help us decide what the promotores program will look like. And we would like to get help to figure out how effective that transition has been. We also would like the group to revise the curriculum, and as usual, to help us with funding. That's one of the biggest barriers we face as an agency. I don't have any more time, but those are the issues and the skills that you would be developing, which is community engagement. You would be adapting a curriculum, you would be helping us evaluate, then helping us with sustainability, talking about policy and advocacy, health communication, and grant writing. And that's my information, if anybody wants to follow up. I'll be up here maybe until around 4:45. So.